I'm Verity. I wanted to share this talk that I gave about a year ago now to one of the Endometriosis UK groups, and it was quite well received then, so I thought I would record it for you all. So I'm going to kick off by potentially offending you all. Sorry, I thought I would start there and then work my way up. So how do I spot a woman with endometriosis? How do I know you have endometriosis as soon as you walk into the clinic? Well, most of you are in running gear. You're catching your breath because you're late for your appointment. You're checking your phone a lot because you have so much to do. You're looking hassled by your phone because you haven't done half the things you wanted to do. And you're sighing because you're pissed off because you haven't been able to achieve what you needed and you've got too much to do. Your complexion is mottled, well, of course, with the blood stagnation that comes with endometriosis. Of course, you'll understand that. But you're usually in great shape, just to win you back round, because you are running around so much, you haven't got time to feed yourself. And so you usually look like you're in great shape. So what do all these bullet points amount to? Well, essentially too much adrenaline. And this is why I wanted to start here, because adrenaline really underpins everything else. So it's worth us really understanding what effects the adrenaline response has on our other hormones. So these are all the symptoms of too much adrenaline. Insomnia, elevated heart rate, anxiety, intermittent systolic hypertension, low insulin, low blood sugar, tremor, headache, and hot flushes. So I'm sure, depending on where you are in your kind of endometriosis journey, you will have experienced some or all of these things. So we need to balance the adrenaline. And how does the body do that? Well, it produces GABA, and every sleep medication, every anti-anxiety medication is a GABA receptor agonist drug. So GABA is really the system in the brain that calms you down. Then you've got endorphins, which of course give you a relief from constant adrenaline. And this is why highly stressed out individuals have to exercise and why you all turn up in running gear. Oxytocin, well, if the exercise doesn't work out for you, then there's always sex. So oxytocin is the love hormone. So this is why sometimes sex addiction can come out of too much adrenaline. And cortisol, which we're going to speak about much more in slides to come. So we won't talk about it too much here. But there are other ways to induce these adrenaline balancing hormones. Breathing, heart rate variability training, improving your sleep. That's really a crucial one, because if you don't get enough sleep, if you're tired, your body has to give you a hit of adrenaline to make up the shortfall. Same with hunger. If you're hungry, you need the adrenaline to keep you going. So it's important to look at those things. Avoid stressful people and situations. Well, that's hard if you live with them, but maybe change your reaction to those stressful situations. Maybe don't be as antagonized as you might be, or walk away from the situation. Acupuncture, of course, we know acupuncture lowers adrenaline, so that's a great one to do. So symptoms of too much cortisol, well, memory loss, depression, elevated blood sugar, awakening at 2 a.m. That's one I hear a lot in clinic. Low DHEA, the cortisol steal. This is an interesting one. So, and this is one I talk to my fertility patients a lot, of course. Pregnenolone is your precursor hormone to DHEA. DHEA makes progesterone, estrogen, testosterone. So that's all your other fertility hormones. But pregnenolone can also make cortisol. So if you're particularly stressed out, your body has to prioritize the production of cortisol over DHEA. It's a nifty little evolutionary kind of thing, really, because it assumes that if you're in a war zone, you don't want to have a baby. Of course, it doesn't really understand modern living. So really addressing cortisol is huge when it comes to fertility. So that's another one. Susceptibility to infections and central adiposity, so central weight gain. And so really adrenaline comes up and it goes down, and it comes up and it goes down. And the more it does that, the higher the cortisol levels will get, which is fine. You need cortisol to get you through stressful times. but it needs to come back down. If you continuously hammer on your cortisol levels, then they will eventually adapt and stay up all the time. And then you will start having cortisol diseases. Things like I don't remember things, putting on weight around the middle, and I don't know why I'm getting more infections. So these are all symptoms of too much cortisol. So the adrenals are extremely important and must be nurtured. I think it's interesting to say that if you cut out your ovaries, you'd be okay. You cut out your thyroid gland, you probably wouldn't feel very well, but you'd be okay. You cut out your adrenals and you die. Like, adrenals are really, really important. So we must nurture them. And I think something that's always quite good to kind of get the message across to patients is to understand your adrenals in terms of an adrenal bank account. And you've gone overdrawn. And the only deposit you can make is sleep. So if you want some adrenaline for a rainy day, you need to build up some reserves. You need to sleep more. And you can get people better just by addressing that kind of adrenal bank account thing, you know, just making sure you kind of really, really monitor your adrenaline levels. So toxic exposure, this is the big one, and really the big one when it comes to endometriosis sufferers. So everyone has a bucket to deal with toxins, but when that bucket overflows, you're going to get things like cancer, autoimmune disease, and neurodegenerative diseases. So we really need to look at this. But everyone's bucket is not the same. Some have a thimble and some have a landfill site. And unfortunately for endometriosis people, you have the thimble. Okay, so we need to really focus on this. So we pick up on all these toxins, and most of them are pseudoestrogens. So we as women are more affected by them. And it's not just single toxins. You add the toxins together and they're worse. So when the chemical industry studies toxins to test their safety, they only study the active principle, and they don't study the inert adjuvants that make small amounts of toxins work even better. And when they did study them, they found that 8 formulations out of 9 were up to 1,000 times more toxic than their active principles. So that's Roundup. Like, I'm sure everyone's got a bottle of Roundup in their sheds. Roundup was among the most toxic herbicides and insecticides tested. Which is just crazy. When you look at a few statistics that I've popped up there, there are around 70,000 to 85,000 chemicals in use today. In fact, this was written about a year or so ago, and I think there's actually 95,000 chemicals now. But anyway, it's estimated that around 1% of these chemicals have been tested. And how do we figure out that these chemicals are harmful? Well, we take time and we all get sick, and there's some kind of like strange cancer that they then start looking into, and they test the blood, and then they realize that all those people have a high level of this certain chemical, and then they ban the chemical. Well, that all takes a lot of time. And so generally we find out that these chemicals are harmful way down the line when they've already done the harm. And then what happens is that they say, okay, well, we'll remove that chemical from the market and we'll replace it with a new one. And everyone goes, oh, great, we've got a new safe chemical we can use. That one hasn't been tested either. So again, you go through the same process to decide whether it's harmful years later. So there's plenty of interesting kind of articles about that. And I've written a few myself about that. A 2005 US study showed there were over 200 chemicals found in newborn baby cord blood. Oh, you imagine them to be pristine, don't you? But they have chemicals. Interestingly as well, recent studies have come out showing that baby boys subjected to high levels of phthalates, so plastics in utero, radically affects their fertility in the future. So really any chemical that they're subjected to now will affect them later. So that's a really important one to address. 25% of women apply 15 or more products daily, amounting to an average of 168 chemicals, which is crazy, but then you add your household toiletries into that too, and your pollutants when you go outside and commute to work, and there is just a barrage of chemicals that are coming at you. So make sure that the ones that you can have an impact on and an effect on are as good as they can be. So improve your makeup and your household toiletries. It's nice and easy to do. There's some good products out there now as well, some good makeup products too. So how do these toxins affect the body? Well, they block hormone receptors, they affect the synthesis of hormones, they change signaling cascades and alter the metabolism of hormones. So how do we know when we measure a woman's estradiol levels that it actually means anything? Like what's real and what's pseudoestrogens? So it's impossible to know, but what we do know is that endometriosis is an estrogen dominant disease. Are they pseudoestrogens or natural? My guess would be that it is born predominantly from pseudoestrogens. So these chemicals are confusing our body and causing us to go after our own cellular structures, giving us massive amounts of inflammation and autoimmunity. So what's endometriosis? It's an inflammatory autoimmune estrogen dominant disease. This is why I believe toxins are the biggest threat to women. This is a slide I picked up just from another lecture I attended, but I thought it was an interesting one to add here. Endotoxins are basically the toxins present inside bacterial cells that are released when the cell disintegrates. It's just one to show you how important diet is, I suppose. Advice for women: never microwave plastic. And again, you know, if you are lucky enough to have a baby in your tummy, really look at plastics. And eating organic. Okay, so animals store the chemicals that they can't metabolize into their fats. So if we're eating dairy and fatty meats, we are consuming the chemicals that animal couldn't metabolize, and we now have to find a place to store it, and we have to store that for life. So eating organic is a big one, of course, and you're avoiding the herbicides and pesticides too. Again, makeup, there's some good products out there. So there's a few blogs on my site as well with some recommendations. So have a look at that. Get an air purifier if you are in the city. Yeah, get an air purifier. Adequate sleep. We've talked about poo every morning. This is your chance to get rid of your rubbish, to get rid of your toxins. So that's an important one. Now, of course, women with endometriosis struggle with bowel function. So this can be a really difficult one, and it just becomes a vicious circle. So is one I really address in clinic is to improve that bowel function as your way of kind of detoxing. So why is reducing toxin exposure so important in women with endometriosis? So this particular gene, the GSTM1, is the gene that sticks glutathione onto things. And glutathione is the #1 detoxification molecule in your cells. So if you don't have the ability to stick glutathione onto things, you're not going to detoxify as well. And people lacking in that gene have a higher rate of endometriosis. So this is why it's so important you don't put more toxins in and you detox. So now you're thinking, yeah, I'll detox, I'll do that straight away. No, don't do it. Beware of the sudden detox. It can be very dangerous. I hear patients in clinic all the time say they're going on a detox. And they say, oh, but I'll only do it for a week and then I'll get back to normal. And I think, okay, brilliant. So you're going to really mobilize those fat cells containing all those toxins, get them really flowing through your body, and then stop and go back to your normal life of adding more daily toxins in. That is a great way to get really sick. The amount of women that go on an extreme diet only to contract breast cancer straight after. No, a detox needs to be a lifelong, healthy lifestyle. Okay, so eat organically. We've talked about that daily sweating, of course, goes hand in hand with daily exercise, but with the exercise, we really need to think about the type of exercise, because anything that puts our BPM above 90 will induce adrenaline. And of course, as we spoke about earlier, we don't want to flood your body with adrenaline. And so it's important that you look at that, make sure that the exercise isn't putting undue pressure on you. Bowel function, of course, we've talked about. So supplements. I'm not a nutritionist, so I'm not going to go into great detail about supplements, but there are a few things that we know can help. Ellagic acid, that's in fruits and nuts. Organic sulfates, get some good salts, and milk thistle to support your liver. Drink watermelon, pomegranate, or celery juice. This is really a Chinese medical thing now, but it's one I get my patients doing because they really don't mind having watermelon juice every day. Celery is a harder one to push, but watermelon is quite nice. So, you know, if you are up for it, then do that. Celery juice certainly is the better one. So if you can get that down, then do it. So food is the #1 call out for cortisol. So a meal that's loaded with antigens or allergens creates an inflammatory process which the body has to do something about. So it calls out for cortisol to deal with that. So going back to your adrenal bank account, if you lower the antigenicity of the food, you have more cortisol in your bank, you add to your adrenal bank account. Lots of women, especially women with endometriosis, really struggle with food sensitivity. This is because the toxic load is so high that they throw anything, you know, slightly upsetting into the system, and they get this huge cortisol and histamine response. What women find in clinic when they've had a bit of treatment is that actually they can start introducing more foods because we reduce the toxic load. And so, you know, they find that like they can go for a pizza and not die afterwards, you know, which is nice because life can be quite debilitating with endometriosis. So you want to be able to enjoy yourself too sometimes. So how does inflammation affect your hormones? This is a bit of biochemistry now, and I'm sorry if this is a bit heavy, but we'll take it slow. So estrogen feeds the COX-2 enzyme, which produces prostaglandins. Prostaglandins cause inflammation, which then raises aromatase enzyme. That then raises estrogen levels, and if you have insulin resistance like PCOS, that will also raise aromatase, which will raise estrogen, which will raise inflammation, and so on and so forth. So if you have too much estrogen, so endometriosis, you've got to address inflammation. So how do we reduce inflammation? So assess life stressors and reduce them. Really important. Sometimes you just need to look at your job and make a change. Less toxins we've talked about, adequate sleep, acupuncture, of course. This is one of the ones that we can really brag about, reducing inflammation, because there's tons of research about it. We know we can do it very effectively. So acupuncture is a cracking one for reducing inflammation. This one, I wanted to pop it in there. It was something I got from a different lecture, but just to show you how important sleep is. So this is what sleep deprivation does to your body. So let's talk about endometriosis specifically. So the definition for endometriosis is a complex disorder that is characterized by the presence of endometrial tissue in ectopic sites outside the uterus and is linked to pelvic pain and infertility. So there are many theories, and depending on when you were diagnosed with your endometriosis, depends really on what theory you were given, if any at all. I mean, you know, often you're diagnosed without really giving any information, which boggles my mind. But anyway, there are lots of theories. The one that sits the best with me, and certainly the one that Dr. Bethany Hayes goes along with, is this, and I'm just going to read this to you. Dr. Bethany Hayes, she is an obstetrician in Maine, USA, and she knows a lot about this stuff. I attended a lecture of hers, which is where a lot of this information has come from, and she speaks a lot of sense. So, so this is the one that I sort of go along with. She said that what is likely happening is that there are altered gastrointestinal bacteria or food sensitivities that are causing inflammation in the GI tract. That upregulates the gastrointestinal lymphoid tissue, the immune system that surrounds the gut, producing high levels of cytokines. Cytokines are molecules that mediate and regulate inflammation. That leaches into the peritoneal fluid and falls into the bowl of the pelvis. These cytokines talk to the totipotential cells of the peritoneum, transforming them into endometriosis, which then upregulates estrogen production and creates its own stimulus to keep growing, which causes the growth of the ectopic endometrium. Furthermore, the retrograde flow that women with endometriosis have means more blood and nutrients go back through the tubes to further feed the endometriosis. So there are some newer theories coming through. Oxidative stress, I do also, absolutely, it is a problem in endometriosis. Oxidative stress is the imbalance of free radicals and antioxidants in the body. It's one I talk about a lot when it comes to sperm health, because it's a massive issue there, but absolutely affects women too. But what I find even more fascinating is that endometriosis cells in the peritoneum make their own estrogen. The endometrium cells do not have this capability, but endometriosis cells do. They are stimulating their own growth. And we know that estrogen has a feed-forward mechanism with inflammation. So there are a number of ways endometriosis changes the hormonal environment. Endometriosis also shows progesterone resistance. Progesterone downregulates estrogen receptors. So now you've just got estrogen just running wild. So what can we do to inhibit estrogen production? Aromatase inhibitors. Some fertility doctors are prescribing them now. In my view, it's not really the answer, but there are foods that are natural aromatase inhibitors. So you might be keen to know that red wine, beer, cocoa, coffee, and tobacco are all aromatase inhibitors. So will inhibit estrogen production. And you're probably all thinking, I gave all that stuff up because I thought I needed to for my endometriosis. But before you run to the off license for your 4-pack and your 20B and H, there are other things you can do to inhibit estrogen production that don't have a negative effect on the rest of your health. So grapeseed extract and green tea extract are all good. And these are some foods that are also aromatase inhibitors. So try and get as many of these into your life as possible. So there's plenty there. So when we think of infertility, is it endometriosis causing the infertility or the pathology that came before it? So a lot of you are there thinking, well, yeah, endometriosis causes infertility. No, it doesn't. And this is just such a common misconception. And I think even one that fertility consultants share, that actually endometriosis doesn't cause infertility. So this is just a really interesting quote. In a 1992 study of 2,080 infertile women, 1,263 with endometriosis, patients who failed to conceive with conventional therapy were enrolled in IVF. Conception rates were virtually identical, regardless of the presence or absence of endometriosis, leading to the conclusion that endometriosis had no impact on fertility unless pelvic anatomy was severely distorted. So of course, if the endometriosis has blocked the fallopian tubes, yes, your fertility is affected. Of course it is. But if you are, if there isn't any of those complications, or there isn't a huge kind of structural problems, then no, it doesn't cause infertility. And of course, you go to the IVF clinics, and because you've got endometriosis, that's all they look at. And actually it can be quite a red herring, and sperm is often the problem. Sperm health has declined by 50% in the last 40 years, and there's no sign of it leveling off. So sperm health is a massive problem. Nobody's really looking into it. So if you have endometriosis and you're going through IVF, don't settle for the fact that it's your endometriosis causing your infertility. Look into sperm health, please. But you're also going to be thinking, so why do women go and have laparoscopic surgery and then fall pregnant soon after? And if it's not the endometriosis causing the infertility, well, you're going in and you're burning off the endometriosis cells and physically getting rid of them. And then you're washing it all down with saline solution. So you're getting rid of the cytokines. So people have less pain straight away, meaning less inflammation, less blood stagnation, and the uterus has seen an intervention. It thinks it's cured. Of course, we know without the previous pathology, the endometriosis will return. But what you hope is that the 9 months carrying a child, being fairly estrogen free, which is what pregnancy does for you, should starve the endometriosis of estrogen, which might give you a few good years of less severe symptoms. And breastfeed as well. Try and breastfeed if you can for as long as, like, till that kid's 10. Keep breastfeeding. So how do I assess the patient? So we talk about your lifestyle, really addressing that excess adrenaline. We look at your sleep, your diet, and your toxin exposure and stress. Of course, fertility problems are stressful, and so that can be a tricky one. But because we look at both male and female components to assess where the issues lie, you know, we can often resolve infertility fairly quickly. So, you know, that's one to kind of think about too. So how do we treat the patient? So we address you've got problems. Absolutely, really important, so that you can help to detoxify. And pain, I think this is one that myself and my associates are always amazed by, how quickly you can reduce pain. And in just one session, you can cut pain by 50%. Not for everyone, you know, everyone's different, but you know, you really can address the pain very quickly. Also, blood flow, because that can become so unmanageable. So we can really reduce blood flow too. Address inflammation, of course, acupuncturists, we do that. That's our thing. Improve detoxification pathways. So supporting the liver, essentially, to help you detoxify, and addressing obesity and visceral adiposity tissue. It's a hard one to get out. So in my clinic, I have absolutely changed the severity of the symptoms. Have they been cured of endometriosis? We never know, because their symptoms are not there, so they don't warrant another laparoscopy. So we never know. I'd love to see some research into acupuncture and endometriosis to see that in black and white, but whether that will come in my lifetime, I don't know. But certainly we can help endometriosis, and particularly when it comes to patients struggling with endometriosis and infertility. I appreciate that this has been quite heavy, and so if you have any questions, please let me know. Happy to answer any questions. Also, I'm aware that this may be going out to some endometriosis groups, so if you want me to come and do a live Q&A, I'm more than happy to do that too. So I hope this has been useful. Please do shout if you have any questions, and have a good rest of your day.